Okay, so now you're motivated, but before you jump off the couch into your running shoes and decide to take on the ultra, you might first want to think about the potential risks involved. For example, how can it affect your health and well-being? Yuan Ma has all the details.
Ultra runners suffer the same muscle aches, pains and sprains that sprinters do, except the magnitude is far greater.
It's like you're running. The typical running stress on the body, of course, multiplied over a much longer distance and sometimes much longer time frames as well. Runners all have very similar musculoskeletal problems: hip pain, knee pain, ankle, foot, that kind of thing.
Dr. Lim, who used to work for the Singapore Sports Institute, has treated all sorts of athletes. And he finds that it's the brutal conditions ultra runners face when they rough it out in the deserts and icy regions that present the biggest challenges.
You have to think about the risk of things like dehydration, all right, risk of heat injury, stroke. Those are much more ever present and much higher risk. Some of the problems actually do crop up at night. It's colder, the muscles tense up more. That's also when you get the cramps more. But at the same time, it's also where your metabolic changes in the body. At night, because the fall in cortisol, body cortisol, what happens is that people are more prone to getting asthmatic attacks.
Ultramarathon organizers usually require participants to be certified medically fit. Some ask runners for the results of their electrocardiogram or ECG test. This usually isn't required in marathon distances or for shorter races.
Because they're running so much, the heart does change, and we know this as athlete's heart. Sometimes it's because the heart dilates so much that it actually loses its contractility, or it doesn't function so well, or because the heart muscle thickens so much that it starts to not get enough oxygen in certain area, and so it can lead to problems either way. Sometimes what happens is that they get this condition called rhabdomyolysis, which basically the muscle starts breaking down under severe stress, and when they're dehydrated and all that. So that can actually cause acute kidney failure.
But health risks aside, he believes ultra running draws several positives out of individuals.
You think about somebody who does this every year, year in, year out, and that's a little bit unusual. And these are the kind of people who tend to be very focused on their work, very disciplined, very, they take a certain approach to getting things done, maybe very goal-oriented. So there is a certain kind of character that tends to be associated with it.
In a nutshell, ultra running is not for everyone.